With the latest on the pandemic.
Less than half of people eligible for the booster.
We're learning a lot from these 3 new CDC studies.
This is the intersection between the information age and a global pandemic. There are plenty of facts, data, opinions, myths, and falsehoods at your fingertips and on your screens. And this information and misinformation is guiding people to make critical decisions about their health and livelihoods.
I do investigate a little bit of everything I see, but again, it goes on just my own personal beliefs of what I think is true.
But I'm sure I gravitate towards what I want to hear.
A key finding in a study by the reputable Kaiser Family Foundation concluded social media, the polarization of news sources, and the rate at which we are learning more about COVID-19 have all contributed to a climate in which deliberate disinformation and misinterpretation can easily spread. And that can be dangerous and even deadly.
As a hospital physician who's taking care of these patients, who's making the diagnosis, seeing it through, and when we lose patients participating and filling out the death certificates, nobody is fudging the numbers. There's no hidden agenda or bias here. We're simply doing our very best.
Pulmonologist Dr. Graham Carlos is the executive medical director at Eskenazi Health.
Well, I'm seeing patients who are still somewhat confused and hesitant about things like the vaccine and how to prevent COVID and if COVID's even real. And when I ask them to name their sources, sometimes it's a friend, but a lot of times it's stuff they found online.
The last couple of years have not only been a long, exhaustive battle against this virus and its variants, but also a frustrating, grueling fight to convince people to focus on the correct data and take proper health precautions.
The overall impact of misinformation and disinformation in the pandemic has been the loss of lives and prolonging the duration of the pandemic.
At Ball State University, Dr. Johnny Sparks is the director of the School of Journalism and Strategic Communication.
The bad actors, if you will, who have some political or financial interest in sowing the seeds of disinformation and misinformation have found very fertile soil in this environment.
Well, I try to teach people through misinformation and disinformation. I ask them to always remember and check, see who is giving you the information you're reading, or is it a reputable source? I ask them to look at what they're reading. Is this something that's based in data and in studies, or is this just an opinion piece by a thought leader or a blogger? And finally, I always ask them to see if there's an agenda. Why are they posting whatever's being posted? Is it to spread information for the common good, to improve public health? Or is it something that's controversial to create strife, to create confusion?
According to the Kaiser study, local and network TV news are the most trusted media sources for COVID-19 information. But the study also found belief in COVID-19 misinformation correlates with both vaccination status and partisanship. Then there's the risk of seeking out articles that only support our preconceived notions.
The audience member will find themselves pretty shortly within an echo chamber. They're hearing only what others who think exactly like they do think about a particular issue. And it limits exposure to diversity of ideas, opinions, and beliefs. And in doing so, in an environment such as a global pandemic, it may isolate individuals to the point that they put their lives at risk and the lives of their family and others around them at risk.
Working for you, Mark Mullins, WRTV.